position yourself so you can see. I would have worn socks.
Taking everyone to wear socks.
Oh, I'm not wearing socks.
You'll be alright. I'm not
Okay.
wearing
Pass this around. This is the proper procedure. We'll follow this step to step from donning. This is the donning. This is the doffing. Donning, putting the suit on, and then doffing, taking the suit off. We follow these steps. Someone will, how we do it in our class, we'll actually have someone, maybe like a third person, like say you would dress her out. You help dress her out, then I'm standing back and I'm reading you instructions. Do this and do this, step by step, and put the gloves on, then put the Coban tape on. You'll see, we'll have one of you read it out, or I'll read it out as we're dressing her. But that's how we follow those steps, right in order.
Is there a way that at the end you can get a copy of it?
Yes.
Yeah, there's nothing for prior.
Actually, I don't. Let me make copies. Okay, great.
So the one thing that we're
Thank you.
the one thing that we're really big on,
Doffing.
obviously when we're dealing with something, any infectious disease, but specifically we're talking about Ebola.
Thank you very much.
We know from what happened in Dallas, we have to be very careful about putting on the PPE and then taking it off, because that's where we're pretty sure the nurses in Dallas were infected, was when they were taking off their PPE. So to ensure that everyone was doing it consistently, we have a checklist, and when they're doing it, we don't want them to try to memorize the steps, we don't want them to try to go ahead of it, and we actually make them stop and go checklist line by checklist line so we can ensure that they're taking it off. Donning, which means to put on, and doffing, which means to take off. Somebody made a lot of money by coming up with putting the D in front of on and off. I don't know why, but it's donning and doffing. So you'll notice as we go through this, I'm not going to move forward until Mark tells me what my next step is, even though I'm one of the ones that helps design the checklist. And I've been in this for like 100 years. I feel like I lived in Ebola land when it was. Gosh, we were doing, what, 14, 16-hour days up here?
Yeah, I was just telling them this place was all the buzz.
It was.
Yeah.
We were 6 days a week, 14-hour days.
Yeah.
It was kind of crazy.
And that we graduated to this type of PPE
Yes.
from what we started with.
So
Which
much
were
fun.
surgical
So
gowns.
This is right.
Okay.
Oh, this is the best. Yeah.
So actually, if we could get one of you who has maybe the checklist in your hand, who would like to be a reader for us? The one that says donning, D-O-N-N-I-N-G. Who has donning?
Always complete this task. Donning task.
Yeah, I have it, yes.
Would you like to
You
be our
mind?
checklist reader for us?
Sure.
That'd be great.
I'll put this one here together.
Okay.
Okay. It says, always complete donning of PPE using a buddy system. So we have a buddy system. Change clothes and put on provided scrubs and socks.
Yeah, I'm not gonna.
Which we'll
Oh,
see.
wait, no socks. Haha.
Yeah, you do have socks.
And we will provide them with a set of scrubs and everything, that way they're not wearing their own scrubs or their own clothes.
So they completely take their clothes off, put on new scrubs,
Yes, ma'am.
and then get in
Correct.
PPE.
Because whatever they were wearing is going to be disposed of as infectious waste, and it actually gets incinerated. So if it goes into the patient room with them, they're not ever getting it back.
Okay.
Even in the PPE, it's just it's an extra step, it's an extra precaution, but it's one that our infection prevention doctor felt was appropriate.
You really don't want it back.
Right.
I'll be happy leaving it there.
Right.
You just don't know, so. Right?
Okay. Remove all jewelry and personal items from the body and secure hair appropriately. Looks
I
good.
wish I had. So when we say secure hair, we've noticed, especially on females, and when they go to take this off, what happens is your hair gets really messy. What's the first thing we do as females when our hair's messy, right? We don't want them to do that. So it's really important for the hair to be up and secure and out of the way.
Mm-hmm.
And then as far as your personal items, your cell phone's in your pocket, you're inside that suit, that thing's gonna ring. You can't get to it. It's impossible. You can't get to it. But then we always worried about if it fell off, it fell down, it's going inside the boot, it's staying in there, it's just gonna be annoying. That's why we just ask everyone to take everything off. And their wallets, everything. Just take everything off.
I see.
Hmm?
Perform hand hygiene with sink washing or alcohol-based hand rub.
I was simulating this, but I did bring a can of foam. I thought.
Did you?
Yeah.
Aha, look at you.
Okay. Proceed to configure the PAPR hood as follows.
PAPR stands for Powered Air Purified Respirator. So these are traditionally used for decontamination practices. So if we have patients that are contaminated with chemicals and other stuff like that, this is what we put our team in to protect them. And so we realized that you can also use it for Ebola to protect the staff member as well. So it has 2 HEPA filters and an internal battery pack, and then it has a hood that attaches to it, and it actually gives you a nice breezy air
Okay.
as you're wearing it.
Alright, so open the PAPR zippered storage bag. You did that. Remove air intake tabs from both filters.
If you do not remove these,
You will not be breathing.
You will not be breathing. They will let no air in.
Okay. Confirm tightness on both filters on the PAPR assembly. Hand tighten only.
Okay.
Alright. Turn on PAPR switch to test. Turn off. If rechargeable battery does not work, switch out with D-cell battery pack.
So these have rechargeable batteries in them, but they also have a configuration where you use D-cell batteries to power it as well. And it's actually inside here, so we can switch between the rechargeable battery and D-cell batteries depending on what you need.
It gives you like about an hour-long little audible beep. If you're in the patient's room and it starts, start hearing it beep, 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 beeping, and then we tested about an hour, but you don't want to wait that hour length of time. But if something happens that the battery would go bad, you can still hurry and change it out in the room without completely doffing and everything. Just slide down the D cell, which they last like 8 hours, so you'd be good for 8 more hours.
Attach PAPR hose to hood and PAPR assembly. Remove shoes and put on protective suit.
So this is called a TICHEM suit. It was originally designed for industrial use, so chemical manufacturing and hazmat teams will use it. It is designed to resist leaking or what we call permeation of a bunch of different chemicals. It has a 480-minute permeation time, meaning it would take 480 minutes for, we'll say phosphoric acid, something really nasty, to actually break through this material and get to the inside. For Ebola, obviously, with biological agents, they're not going to do that. That's not how biological agents work. They don't eat through plastic. But that's why we went with this, because it's completely sealed. And if it's going to protect you from the nastiest acid known to man, it's probably going to protect you from that virus as well. And that's actually what the CDC recommends, is to use something like this.
From a permeability standpoint, does that mean that you're not getting any air flowing either?
That's why we use the PAPR, because the PAPR actually, and you'll see when I'm wearing it, the PAPR is pulling air from the outside of the suit. It's purifying the air with the filters, and it has been, they quickly did research on it to make sure that it would be sufficient for Ebola. Because Ebola is not an airborne hazard, because it's a contact and a droplet hazard, the CDC did give the green light to using these PAPRs for Ebola. So what happens when I put this on is I'm actually getting air from this device.
You'll see the suit, it'll puff up.
Okay.
I should
Can you read it yet?
Yes, ma'am.
How much have exactly what materials though? What kind of plastic?
What kind of plastic?
Why on our
Where's-
check?
Yeah, where's the sheet go? I'll be honest, I don't know off the top of my head. I'm gonna read.
I'll tell you on there, different chemicals, different permeation times, how long it'll last.
Oh, no, it's good. It is a Zytron 100 fabric. So Zytron, Zytron 100.
You ready for the
Yes,
next
ma'am.
step? Alright. Using boots 1 to 2 sizes larger than normal size, pull toes of the bootie on the suit forward and over the top of the feet. Slide feet into boots.
So this is just something we tell our people to do. I can't talk today. I'm actually a hazmat technician for the U.S. Air Force, And because I've been in the level A suits for so long, I've realized if you don't push the toe up, because I have tiny small feet, your toes do this, and it's really uncomfortable to have your toes squinched like this for 4 hours. So that's kind of one of our little tricks that we teach people.
Another question, can you dress by yourself or do you have to have someone to help?
You can dress by yourself. Where we don't want people to not have a buddy is doffing, because that's where the highest risk of contamination is.
Okay.
Most of the things you can do by yourself. That once you get the hood on, it's a little more difficult because they can be hard to move around. But 90% of this you can do by yourself.
Okay.
And we like to do on the buddy system also, because it's just another set of eyes.
Make sure you have it on
Make sure that she has it on properly. And
And we still have someone read, right? So you have the buddy system and you have a reader.
still have a reader.
Yeah.
Then for the flaps,
Tape top of boots using duct tape to
Oh.
prevent fluids from
No, that's the
entering
old one.
boots.
Oh, no, you're using the old one?
no, that's the old one. So,
Oh,
That's okay. That's
Yeah.
okay.
So I'll
Okay.
tell you, during this process, we went through 1,001 modifications.
Yes.
Everything, when Dr. Friedman goes on national TV and says stuff, everything changes, and we go back to the drawing board. So we have a lot of this modification until we got a final one. So it's not unusual to think you print the real one, you're like, oh, wait a minute, oh, this is the old one.
Yeah.
You just keep changing until, even now, if we have an Ebola case in the country right now that's huge, there's gonna be a little chaos again as to what it's supposed to be, because it changes every day.
let me show you real quick. We used to wear a suit this is what it basically did, went inside the boots, and then we taped the boots. And then we came up with this suit that you have the outside flap. It's sealed, the flap covers the boot up. So now we don't have that problem anymore. You know, anything going down into the boots or anything happening with the outside flap, it goes over the boots, and we have no worries anymore. We don't have to tape up or anything.
oh, nice.
And these are the newer ones, the ones we had before, you want the military grade one,
Yeah.
Yes, sir.
that was very cumbersome.
Yeah.
I mean,
This is a lot more lightweight.
this is lighter, you can breathe easier. I've had to work in that one, oh my God, it's not fun.
Oh, wow.
For the doffing, does the buddy have to have any specific gear?
They're
or
gonna
wear-
be, and we'll get, when we get to the doffing part, it actually says that anybody who's doffing, somebody who's been in a room with an Ebola patient has to be in the same level as PPE. The way we have designed it is, if I was the nurse and I was in the room for 4 hours with a patient, and then it's Mark's shift. So Mark would be coming in to take care of the patient, but prior to starting patient care, he would help me doff my equipment, and then he would continue
So
the
that she
patient care.
could leave and then I take over.
Okay. All right. Put on inner gloves and pull protective suit cuffs
Yeah, see,
over
that's the little one.
gloves.
Yeah, that's okay. Where'd you get it from?
No, no, I mean,
Oh, you might not have the new one.
yeah.
So in reality, what we're also going to do, and the reason we're not using them in training is because the gloves are a little bit more expensive, but we're actually going to use surgical gloves, which come up to about here. So it affords the staff member a little bit more protection. But for training, these are the more cost-effective gloves, so this is what we're going to use.
All right. Use co-band tape to tape inner gloves to protective suit. Wrap around wrist twice.
Most times when they get to the doffing of the hood, we'll have to stop them and
Right.
walk them through the actual.
Jamo might be trying to print out the
Okay.
right thing.
Yes.
So like when you tape the wrist,
Mhm.
does it limit the?
No, it's very, very flexible.
Yeah,
Oh,
it's the same material like when you go and give blood. It's what they put on you to hold a little ball of cotton on. That's fine. I could start a 90, I think. I think that'd be
Oh, good.
good.
Does it say tuck the hood?
No, it wouldn't, not on that one.
It does say Buddy will tuck in the protective hood into
Oh,
the
it does
suit.
say that, okay.
Yeah.
We've had, like Dr. Adewale said, we've had so many versions of this checklist.
So we're gonna start training soon too.
Yes, we are.
Yes.
Yes, we
More
are.
than training.
Alright. It,
Okay.
okay. It says turn on the PAPR breathing device.
This is where it's gonna be a little bit different.
Alright. Buddy will hold PAPR assembly and hose behind and along back, while Donner puts on PAPR hood and adjusts it to conform internal headband.
Alright?
Buddy will hand PAPR to Donner to hold with right hand.
Now you can see on here, that's why we left the suit all unzipped and everything on it. Because this has two flaps on it. This is going to be the outline flap. This is the inner flap. This is where we're going to protect her. So we're going to tuck this inner flap in all the way around. And the air will be coming underneath that inner flap. Okay. I'll let her pat her own Velcro down.
Okay. Alright. So Buddy will hand PAPR back to Donner to hold with right hand.
You can skip past that part.
Oh, okay. Buddy will make sure outer PAPR layer is outside the protective suit. And then secure PAPR belt assembly to Buddy to assist with securing belt around the waist. Securely tighten excess belt.
You see it? You can see these little slides we have on here also. As she gets it tight, it'll slide and it really holds the belt proper with your waist instead of dangling down or maybe getting contaminated or anything. So we adjust it right. Alright.
Okay. Apply second set of gloves, one size bigger than original pair, over the first set and cover the cuffs of the protective suit. Check for tears. Okay. Buddy will do a walk around to double check on all PPE.
See how she's starting to fill up with air?
The Stay Puft Marshmallow Man.
Yep. Do a walk around and make sure it's all tucked in and make sure she's got it tucked in tight up top. I check her boots, I just check her gloves, make sure there's no tears. You can see her legs, you can see it all filling up with air right now.
Very fashionable.
Yeah.
Great.
And safe.
And say, yeah.
Very safe. And you guys will get to experience this when we don and doff you, but you can hear me very
Yeah.
easily. And at the previous PAPRs, it was very difficult to hear and to be heard.
Yes.
This is a lot more lightweight. I should have air coming from my hose here, and it's actually going over the top of my head, which is why I'm puffed up. And it's very comfortable. I don't feel hot or restricted. I actually had a Linda from your ED, who is claustrophobic, and the other ones, and she was very nervous to put this one on, and she put it on, and she was like, "Woo, I'm good,"
Yeah.
because you don't feel as claustrophobic or as contained in this one, and it's a lot more lightweight. So this is it's actually, I don't know, I can say it.
So is this a lot more expensive than the other PPE that you have?
The ones with the double gowns that we used before.
This is
Yes.
more expensive than doing the double surgical gowns, which is what we originally started with. I don't know the exact price on it. I'd have to talk to our safety director, who's the one who ordered them. But in comparison to how many surgical gowns we have to go through if you were wearing double surgical gowns, and we can just wear this one suit, it's a little more cost effective because we're not going through as much.
but our protection went up. Before the
Yeah.
gown came to here, and the boot started here, and sometimes we had a spot there with just the scrubs on. Those, you know, we try to make the gowns longer, but you always had that problem that someone didn't quite listen when they sat down. The gown kind of rose up. If it rose up above the boot, then we was always worried about that little section right there.
Right.
You know, so this here we don't have any problem at all. You know?
Our staff safety is always,
Yes.
in this whole venture, staff safety has always been the number one priority. And so our chief medical officer, Dr. Moorhead, said we need to make sure we're protecting our staff and we're getting the best of the best. And that's what we did.
Great. And then the final step would be to disinfect the outer gloved hand with orange top PDI wipe.
I didn't bring an orange top.
Right.
I have a gray top.
Right.
So just imagine she's outside the room right now, and we're ready to send her in. She's gonna go ahead and disinfect everything before we send her in. She'll throw that in the trash can.
And I'm doing this because I can't wash my hands and I'm about to provide patient care. So our protocols for patient care is anytime you're walking into a patient room, you have to either foam or wash your hands. That's what all of our clinical staff does. Well, I obviously can't do that because I have gloves on. So I'm using our PDI wipes to make sure that my gloves are nice and disinfected before I provide patient care.
I was just gonna ask, what's the difference between the gray top and the orange top?
The orange top actually has a bleach compound in it, and CDC and the World Health Organization say bleach is the one thing that they will guarantee, well, not guarantee, but that they feel comfortable will kill the Ebola virus. So we use orange top.
Is there a possibility for the hose to get in the way and possibly be dislodged?
We're gonna live close to the
Is there a possibility for the hose to get dislodged or like get in the way?
go ahead and give it a go.
It screws on.
As long as it's hand tight, you shouldn't have any trouble. And because the hose isn't very long, I can't imagine anything I would be doing, even at the patient bedside, that the hose would prohibit me from doing something.
Yes.
Have you ever had to use a glove that's a thicker material similar to the suit itself, and would that be more effective in terms of safety? I noticed that there's a level 3 suit that has that kind of glove, and would it be harder to manipulate fine tools?
Yes.
Okay.
We actually we have an internal EMS service, so we have our own hospital EMS, and they're currently using what's called a level A suit. And level A is traditionally what hazardous material teams wear, and it has an attached glove. And because they're not going to be intubating, hopefully, or starting central lines or starting IVs, they can wear that. But you lose your dexterity in your hands and your ability to really do fine motor skills. So we went with this because our physicians and our nursing staff said, look, we want to be protected, but we really need to still be able to intubate, start lines, start IVs. And this was the perfect solution for that because they are protected, but they still have that dexterity that they need.
And I have to tell them, you practice delivering babies in
Yes.
this too, which is
Yes.
Wow.
Yeah, they've practiced
Yeah.
delivering babies, starting
Yeah.
they've done it all.
All kinds of scenarios.
Yeah.
You'll feel it when you get the 2 sets of gloves on. You don't lose too much with that much protection, and you can still feel.
No, I think I'd be able to do anything.
Can you show us how you take the battery out and put it back in?
Sure.
As soon as I take it off.
Okay.
It's not something you can do while you have it on.
Right.
Oh, okay.
Yeah.
Yeah.
But I will be
You
happy
said
to.
it gives you a 1 hour notice if your battery's low,
It does. It
so,
starts going. It's an audible beep.
Beep.
so you'd have to leave though too.
If something, like I always said, if something would go wrong in the room that maybe one of them just didn't get fully charged up and you're in the room for an hour and you're supposed to be in there for 4 hours, if it starts beeping, it's something that she can just undo the belt, put it on a table, and inside the room we'll already have the other battery. See, like, I can turn her off right now, and she can still breathe. She can still breathe, because now instead of it being forced air into the hood, she's just sucking it through the filters.
It's the ambient air that's coming through the filter.
Just regular ambient air coming through.
Through little.
And you'll see it fog up on her a little bit, and then you turn it on, and it
Okay.
goes away. So she would have enough time to bring it around, set it on the table behind her. It's real easy to pop it out, pop the new battery in, and then she's good for another 8 hours, instead of coming out, doffing,
Yeah.
changing the battery. We already talked about, we'll leave those in the room already, in case anything happens,
Okay. Is the air, the forced air, is it set at a certain temperature?
I don't think it's a certain
No.
temperature. There's a small motor in it that it goes through the filter and then it circulates it up and out. If I was to hazard a guess to how cool it is, I'd say about 71 degrees is what it feels like.
And
It's
that
very
works
cool.
well if you're inside. If they were like outside, like at a hospital in a developing country and wearing this and it were warm.
It would be hot.
it'd be hot.
We use something similar to this for our patient decon teams, and that does happen outside. And for those purposes, we use things like ice packs, so ice vests, that it keeps their core body temperature down. But when you're working out in the elements, we have something called work-rest cycles. So depending on the temperature, there's a prescribed by OSHA. There's a prescribed time limit you can be out in this get up and working. Yeah. Okay, any other questions? Yeah.
Just one more. During the simulation with the PPE, what was the temperature like in the room where it was simulated? Did you try to make it a little warmer to see what it would be like in a hotter climate, or?
We did not.
Okay.
We did not. We actually, the simulations happen here, and we have patient rooms. And it would, because all of our hospitals have very, very technologically advanced HVAC systems that keep the parts that need to be cooler, and keep the parts that need to be warmer. It's not like you can just take one room and lower the temperature. It's a little more difficult than that. But that's a great idea. It's not something we've thought about doing, but it's definitely something I think would be interesting to look at.
Cute.
Any other questions about donning? Okay.
All right.
Who's got
Who's
the
got the
dolphin?
It's gonna be a little different, I believe, but we'll see what the dolphin says.
I also have the doffing
Doffing?
to
Oh,
help.
You
well,
want
look at you.
Yeah.
The only thing that's, like, if you get an itch, you
Yeah.
can't itch it.
Oh.
An itch right now. You just kinda
You're
have
sitting
to-
there always going, on your
Yeah.
face, you just can't reach up there. And your face will always itch when you're in there, because you can't scratch it. So it's always gonna bother you, so.
Yeah.
All right. Always complete doffing of PPE using a buddy system. The buddy will be completely donned inside the patient room.
So we're gonna pretend
So
he's
just
wearing
pretend
the same
I
thing.
look exactly like her right now. We're
Okay.
twins.
Inspect the PPE to assess for visible contamination, cuts, or tears before starting to remove. If any PPE is potentially contaminated, then disinfect using the orange top PDI wipes or disinfectant wipe, moving from top to bottom.
Okay.
So if we did see something, so if it was a particularly bad day for that patient and I had visible body fluids on me, we would wipe it off before we even began taking this off.
Oh, good. Unlock papper belt and let it drape behind the back from the papper hose. Okay. Inspect and disinfect outer gloved hands with an orange top PDI wipe or disinfectant wipe and allow to air dry. Alright.
And you're gonna notice we have a lot of inspect and disinfect gloves. Anytime we touch a PPE, so this is now considered dirty. So my PPE is now considered dirty. Anytime I'm touching it, I'm going to inspect my gloves to make sure I have no tears, and then I'm gonna disinfect my gloves. That way I'm not spreading the potential contamination. So anytime I touch my suit, I'm disinfecting my gloves before the next step.
Okay. Hold one of your wrists so that your thumb is up. Pinch that glove and lift at the wrist, then roll it down until the glove is completely off your hand. Alright. Collect first removed glove in the palm of the opposite hand. Slide a finger down on the inside of the outer glove on the other hand and pull it off until it's balled around the first glove.
I think this is fascinating, this part of it.
Tell them guys why you put the finger in the second glove versus doing it the same way you did the first glove.
The same way.
I will be honest, that's the approved infection prevention way of removing gloves. It's actually what our nursing staff is taught to do. This is the way that they, through their bajillion hours of research in the infection prevention world, this is the way they have found to remove gloves without contamination. I don't know the science behind it, but I'm told that's the infection prevention approved way.
Now, in the
Now that
room,
hand is cleaner than it was,
Yes,
right? So you're trying not to
exactly.
touch now the dirty
the
glove.
dirty part of the
You're gonna
glove.
go inside.
Right.
Instead
of her pinching that other one with her supposedly clean glove, instead of pinching it and contaminating even more, she's just gonna try to slide her finger inside. And now in the room, we'll have, who knows how many, but we have 30-gallon drums. They're waste drums. We're already having staged, they'll be in the room, and that's what we will discard everything in that we take off. We'll throw it in the 30-gallon waste drum. And there's a screw top. When we're ready to ship it off, we mark it, Ebola, and screw the lid on it, tape it. It's never touched again. Never opened.
Good. So I saw that you disposed of the gloves.
Yes, in a proper container.
Yes. Inspect and disinfect gloved hands with an orange top PDI wipe or disinfectant wipe and allow to air dry.
She wouldn't be handing it back to me.
Right.
I'm just using one instead of.
Okay. To remove the PAPR assembly, Buddy will detach hose from back of the hood.
Alright. So. And I try to touch them the least I have to, because I'm going into the room. So I'm going away their hose, and I'm shutting their PAPR off. Alright?
Okay. Buddy will hold the PAPR assembly and the doffer will unclasp the belt.
Alright?
Okay. To remove the PAPR hood, Buddy will stand behind the doffer and grab the outside of the hood and roll the hood up, forming a cuff.
Okay.
Okay. When told to do so by the buddy, the doffer will grab the hood near the ears on the outside. Doffer will bend forward at the waist and pull the hood slowly down and away from their head until it's at waist level. Discard hood in proper waste receptacle.
See, this is all clean. It's coming out, so I can take it. And then I'm going over to the barrel, and I'm dumping it in the barrel. Okay?
And it does say to not touch your face, which I see
Which
you're
I'm
doing.
trying really hard not to do right now.
Doing that little nose dance.
Remove duct tape from boots and remove boots.
We don't have.
Oh yeah, you don't have the duct tape.
The old one, we used to tape the boots.
Right.
But now that we have the one that snaps, you don't use duct tape anymore. So we gotta get the real one.
Yeah.
So these are the newest model of PPE that we got. We've gone through several of them, but this is the best one.
Let's show them the buddy map.
Yeah. And if you don't want to really grab it on the bottom. She's been walking around in the room. It's so nasty. So if you grab it up high, the boot will slide right off. Remember, we're using like a size or two bigger for this purpose also. And plus the suit, once the suit's tucked up in there, you're not going to feel a size or two bigger. So that's the reason we do that also. So we can remove them a lot easier. You get a size that fits you and you're really jamming it on, we're going to have a hard time getting it off.
Yeah. Okay. Inspect and disinfect gloved hands with a disinfectant wipe and allow to air dry. Okay. Using right hand, pull away adhesive tape from zipper area.
Which it changed to Velcro.
It is.
You can see that vessel is like a double layer. As you open it, you can see there's no contact. It's completely sealed.
Right. Using left hand, unzip protective suit all the way down with the zipper tab.
And then the glove she has on now is a clean glove. Sterile gloves, it's clean gloves, but they took out the.
Remove co-band from gloves.
I can do that. Oh, you did give me a
See, I'm letting her do a lot on her own, She just throws it on the floor for me to pick up. That's okay.
Okay, inspect and disinfect gloved hands with the disinfectant wipe and allow to air dry. Okay, Buddy from dirty side will assist by completely opening the front of the protective suit and pull down over shoulders. Buddy may not touch inside of suit.
Right, so you see how I'm grabbing? I grabbed on the outside of the shoulders. I'm not going inside here and touching anything inside. I'm grabbing on the outside of the shoulders, pulling it down and past her hands. So she can pour it and hold on to it, so she can pour her hands and pull it inside out. And everything's staying clean on her still. It's all inside out. So you can see.
Right. Okay. At this time, the doffer will pull hands completely out of suit. Buddy and doffer inspect and disinfect gloved hands with orange top PDI wipes.
And when in the risk scenarios, we have all these wipes in the room.
Oh, yeah.
You see everything there. It's like
Everything.
visible. You can see, you know. You have this big 30-gallon drum right there that is coming out.
Going right in.
Okay, to remove inner gloves, hold one of your wrists so that your thumb is up. Pinch that glove and lift at the wrist, then roll it down until the glove is completely off your hand. Collect first removed glove in the palm of the opposite hand. Slide a finger down on the inside of the outer glove on the other hand and pull it off until it's balled around the first glove, and then you disposed of the gloves. Doffer will wash or foam hand thoroughly from elbow to tips of fingers, pointing fingers in a downward motion for 15 seconds. Apply a fresh set of gloves and check for tears. Gloves must come from the clean side.
Right. If somebody outside the room would have just tossed them into her, or handed them into her, from the clean side. It wouldn't have been me, because we're not going to have gloves in the room that I'm just going to dig them out with my contaminated hands to hand her another set. So they'll come from the clean side in.
Okay.
So you have like the dressing room, the clean side, and then where the patient.
Yes.
Right.
So this is all happening, showing you, just see me do that. This is all happening at the threshold of the patient room and what we're considering the clean area, which is just past the patient room. So that is where all of the doffing happens, is literally at the threshold of the patient room. So we're as far away from the patient as we can get. CDC recommends 3 to 6 feet for doffing purposes, because they don't believe that the body fluid can travel more than 6 feet. So we're trying to be about 3 to 6 feet away from the patient. We're doffing in the patient room because we want all the dirty.
Oh, you're actually doffing in the room.
Oh yeah, you cannot come out with that.
No.
So once they're done with this demonstration, I will show you where we actually stay in relative to the bed in the room, and where the patient is, and where we actually have a tape that says, okay, this is where you doff. Come outside and take you doff.
And do not cross line.
Yeah, you cannot come outside with that.
Okay, roll using the clean inside of the suit down below the knee while standing near clean area. Step out of protective suit into clean area with buddy assist.
See, I could probably step on it for her and hold it, you know? Just drag it back in, and I'm going to pick it up, and then same thing, discard it in the room, in the bucket.
Remember, the buddy also has their own
Right.
PPE. So the whole naturally goes help her, so she pulls out, and as she's stepping out, she's not stepping into the patient room, she's stepping out into the clean area. And that's the, yeah. Go back, gotta stay behind that.
Okay,
Complicated, right?
it is.
And you have to imagine what her body physiology is going through from the time she puts on that gown. With that gown and doing all the procedure, IV, whatever, temperature going up, heart rate going up, blood pressure going up, and now to take it off. See how much work it takes.
It's a lot.
And mind you, most of the nurses might be in this outfit for 8 hours or 4 hours straight. Because we try to stay, once you have it on, you stay in that room with that patient until it's time to go have lunch.
Right.
Then someone come in and release you. You're going to be there for 4 hours. So it's can you imagine sitting there for 4 hours?
Piece of cake, Doc.
Taste the change.
And then the last step, which is probably on there, is I removed my gloves and threw them back on.
Yeah, I don't know if you saw that, she did remove her gloves and she tossed them back into the room.
And then I would go take the longest, hottest shower of my life.
And Clorox. I mean, yeah.
And Clorox.
So that's it. Does anyone have any questions on donning and doffing? Okay, well, I think, do you want to show them
Just the location.
and then we'll get you guys dressed out. How's that sound?
That's fun.
Alright, let me show you guys the demarcation zone. We'll just